We've invited superintendents, principals, facility managers, and service providers that support schools through their products and services to learn about purge virus, how to stay safe and healthy. We're going to cover 5 big reasons, and those reasons are about the schools and specifically the relief bill funding and how to improve indoor air quality, that's IAQ, to combat COVID-19 and future pathogens. We're going to start by talking about protecting your students. Get clean air. You have multiple choices for resource allocation within this relief bill. Now you can increase safety for students and faculty by improving indoor air quality for short-term and long-term benefits. We're going to talk about systemic improvement first. Masks, hand washing, and social distancing are all great, as well as vaccines for short-term fixes. But IAQ is a systemic long-term solution. Here are the 5 reasons for IAQ. 1, COVID-19 is an airborne respiratory disease. It travels in the air, so we should look at the air and how to improve air quality. Ventilation is a great starting point. Disinfection technologies are proven and affordable. So number 3 is really upping the game from just ventilation. And IAQ can save lives as well as save energy. 5, the health benefits transcend COVID-19. We're going to cover that at the end. Okay, COVID-19 is an airborne respiratory disease. The CDC, Center for Disease Control and Prevention, has guidelines, and they initially focused on masks, social distancing, hand washing, surface cleaning, and contact tracing. Those are the big 5 on the top of this set of rings of orange circles. What they did not do initially is really promote the need for improving air quality. But they've updated recently, March 23rd, the site. The website speaks to the advantages of ventilation and clean indoor air. Our Purge Virus team created this graphic to emphasize that air is at the center of buildings and COVID-19 mitigation protocols. Welcome increased ventilation. We welcome vaccines. We welcome testing and screening, as well as all of the other protocols. But looking at air is a logical conclusion when you learn how COVID travels through air. Now, the CDC quote recommends a layered approach to reduce exposures to SARS-CoV-2, the virus that causes COVID-19. This approach includes using multiple mitigation strategies, including improvements to building ventilation, to reduce the spread of disease and lower the risk of exposure. Here's the link. It's the ventilation sublink to the CDC website page. And we highlighted in bold improvements to building ventilation because it is an awesome starting point for IAQ. Now, Purge Virus begins, right? We start with ventilation per the guidelines. But ventilation is complicated when it comes to aligning the right technology and correctly integrating advanced filtration, air quality meters, energy recovery ventilators called ERVs, and economizers that integrate with the building management system, BMS, also sometimes referred to as building automation systems. Now, a surprising small percentage of HVAC service providers have the depth of engineering and expertise to improve IAQ effectively and affordably. And we're going to really talk about affordability because we know even with the money from the relief bill, this is a systemic change that's going to take more than just doing parts of buildings. To ensure optimal results, Purge Virus works with leading HVAC companies. Some may already service your school. We welcome the opportunity to work with them to up the game, educate and inform on how this new technology can basically save energy in addition to the ventilation. Okay, number 3. Consider using ultraviolet germicidal irradiation as supplemental treatment to inactivate SARS-CoV-2, especially if options for increasing room ventilation and filtration are limited. Upper room UVGI systems can be used to provide air cleaning within occupied spaces, And in-duct UVGI systems can help enhance air cleaning inside central ventilation systems. Very important, and we've highlighted here the upper room and the in-duct for UVGI, two types of technologies, all based on ultraviolet that we have been providing to customers. Now, here's how upper air room works. You put these devices typically about 7 feet as a minimum from the finished floor. Ultraviolet light is sent from those devices across the lower level of that ceiling. Well, ultraviolet is not good to look at, right? The stratosphere has a huge advantage for humans on Earth, thank you, Mother Nature, by blocking the ultraviolet light. Typically, 53.7 nanometers is the assassin, the most dangerous for COVID-19. It can also create problems for humans, skin cancer, issues with your retina, all kinds of bad stuff, which is why you don't want to look at it. So when it's an upper air device, the air is flowing through the room across the ceiling on its way to the return ducts and then into the air handling system to be pushed down from the fans into the rooms. So you have a natural cycle. Typically, the air changes per hour may be between 4 and 6. So 4 goes into 60 15 times. That's every 15 minutes. If the AHU, air handling unit, is moving ACH, air changes per hour at 6, that's every 10 minutes you're changing the air in those rooms. And each time through those cycles, you're cleaning the air with ultraviolet. Now, it's more costly to do it in each room than it is in the ducts, which is why we use the trunk ducts and the air handling systems as the source. So in this case, these devices, and they run in different lengths, go about 3 feet across. So a pair of them coming in will have the coverage as a gate in about a 6 foot wide duct, or in a plenum, which is the area right after the coil of the air handling system. If it's placed correctly, and here's where we provide the guidance for the installation teams, we can also clean the coils from mold and mildew, which saves energy and time on maintenance. The double advantage of cleaning the air and cleaning the coils for saving energy. Now, when this ultraviolet in the zone, the purge zone, is cleaning the air, it is basically preventing the COVID from replicating. So it's inactivating the COVID with 50,000 devices, and our manufacturing partners that have done this since the 1960s. This is not new technology. It's been used by hospitals. We have trailing experience now with hospital-acquired infections and a whole story that preceded COVID-19. It's about applying this technology to the schools, the businesses, the healthcare facilities, and even, the dental practices that were some of the very early adopters of, say, those upper air devices right here in our own backyard of Philadelphia, starting with single practitioners to groups. Okay, beyond ultraviolet, there's some other options, and these have to do with electrostatic disinfection. So here's the quote from CDC. When considering the acquisition and use of products within technology that may generate ozone, verify that the equipment meets UL 867 standards and for production of acceptable levels of ozone, or preferably UL 2998. And those standards are 0 ozone emissions from the air cleaners, which is intended to validate that no ozone is produced. This quote is from the subset of the FAQs from the same link on the CDC website as some of the prior pages. We highlighted UL 2998 because there are very few companies that go to that extreme level to have 0 ozone. We happen to have, with the manufacturing relationships, that capacity. And it's really been in the last 3 years that technology has existed. So there's a lot of confusion in the marketplace about which device to use. But with ozone, there's an issue with human respiratory, challenges as the levels increase. No ozone is the safe bet. Okay, in addition to ultraviolet, on a case-by-case basis, we use advanced bipolar ionization that does not generate the harmful ozone. very important. The bipolar ionization is often an excellent alternative to the ultraviolet disinfection in the heating, ventilation, and air conditioning systems. It's about sizing the technology for the dosage that makes the most sense for disinfection to the existing HVAC equipment. Certain types of systems are not as relevant for one technology over the other. Okay, let's talk about the clean air from ionization. It's natural. Ions are present naturally in the air and are found in the highest concentrations where the ocean meets the shore, that's the waves crashing, and high elevations in mountains, also waterfalls, even lightning strikes. Ionization creates the ions found in these desirable locations and distributes them into the building, enhancing the indoor air quality. So this is proven scientific technology. The process has been around since the late 1800s, not new. I know people are nervous about new things, but this is proven, and it's really about adapting it to any given facility like a school or a business. The units of measure. Well, ions per cubic centimeter are how you determine density. In the waterfalls or the high elevation or the ocean, you might have 5,000 or more ions per cubic centimeter. In a city, it's shrunk way back, 200, 300, 400, maybe up into the 1,000 range. But inside buildings, it's often less than 100. This is why people say, go outside for fresh air. It's spot on accurate. Yes, outside air is fresher. That's why restaurants had outside dining during COVID, during the peaks. Well, now we can mimic what is happening with outside air inside and make it safer inside than outside. Some of the sample technology, small, medium, and large systems. It starts with the carbon fibers. Those are the ion emitters, and think of them as little distribution channels for the ions. And we're going to have a discussion in the next slide too about how the ionization actually works. But this is about the equipment. So this strip, it's the one on the left here, is ideal for package terminal air conditioning units, like the ones you'll see in a hotel or that might be in a retirement nursing home, healthcare facility where you can control the temperature, heat and cold directly on the unit. The middle one is more for mid-size systems. It would be roof or air handling units that don't have typically, the same configuration limitations of those package units. And then there's the modular side for much larger systems. Typically those could be, you see them, sometimes they're the size of a tractor trailer on the roof of a building. Well, they're sized based on cubic feet per minute. So 3,200 cubic feet is up to about 8 tons for the small ones. Those emit 35 million ions per cubic centimeter per foot. So a 3-foot strip would yield 105 ICC. Again, great for the rooms that have them right in the wall, those units, because you don't have to worry about transmitting any of the ions through the ductwork, where they can bang up on the walls of the duct and reduce the volume of the density. In this case, for the mid-size one with 4,800 cubic feet per minute and up to 12 tons, you're now a whopping 400 million ions per cubic centimeter. Much bigger because, again, for ducted systems, those ions are traveling. So by the time they get to their destination in the individual rooms, there's a much lower density. When it comes to the modular system, 840 million, and that is per 6-inch increment, the little units that are modular. Again, we work with the installers, the HVAC companies, the customers to size the right system, crunch the numbers on the cost and the energy savings and all the good things that can happen from this technology to make sure that the dosage is correct in terms of disinfection. Now, a little science. It starts with an electrical charge. So you're imparting some form of energy to a neutral oxygen molecule, the O2. Two things happen. It kicks off a positive ion and it kicks off a negative electron. The positive ion starts to seek out the pathogens and what are called VOCs, volatile organic compounds. And those then are going to attach to COVID. And in the next slide, we're going to start talking about how it inactivates COVID. But you want the more ions, the better, positive and negative. The negative is integrated. Basically, it is captured by a neutral O2, and that becomes a negative ion. So now you have two forms of ninjas, positive and negative, going after COVID. Okay, in the blower, you're seeing that in the case of this with a positive and negative ion generator and the paddle, as the air is passing through, it is sending this flurry. So envision it like a snow flurry coming down. Each of the ions is like a snowflake. The more the better in terms of the density to connect to those COVID acellular microorganisms. Now, the target ion density is important. With bipolar, the effectiveness is based on the number of ions. So a target level, like of air purifying ion density, is at least 1,000, if not much more, per cubic centimeter in the space. We're trying to exceed what is outdoor levels and getting towards the density where there is as many possible chances to attach to those spikes. Here's how the science works of the spikes. BPI, bipolar ionization, inactivates the airborne virus. Bipolar ions surround the hemagglutinin, that's the surface proteins that form on organisms and trigger infections. And they change into highly reactive hydroxyl radicals. Now, the ions destroy the virus surface structure. This is really cool. Like, this is great biology. In the case of coronavirus, the spikes are at that molecular level. As a result, the virus cannot cause infection, even if it enters the body. So, in the mix of this, we try to put together kind of an analogy with magnets. If the magnet on the spikes is like attracted to the human cell as a steel ball, think of the ions as blocking each of those spikes from connecting. In the testing, it's very important to understand the levels of density and time with that flurry of ions. So 99.4% reduction rate of the CoV-2 at the surface strain within 30 minutes. And that's the first instance in which an air purification company has effectively neutralized SARS in this manner. So the laboratory study was designed to mimic ionization conditions like that of a commercial aircraft fuselage, and it determined through the testing that within 10 minutes you had 84.2% inactivation, and 15 minutes was 92.6. When you get to 30 minutes, you're at 99.4. Since it runs continuously, you have that ongoing benefit of keeping the rooms clean. Okay, measurement and verification, very important in our process. Field teams carry the ion meters and they're performing the before and after. So in this case, the A1C2 handheld measures both the positive and negative ions that are often present simultaneously. Now, this instrument is a true ion density meter, and it's based on this Jordan tube condenser design. We don't happen to make this meter, but we're basically promoting measurement and verification so we can demonstrate to customers the advantage that they've gotten when it comes to ion density. This one is selectable for maximum ranges, both 2 million and 200 million ICC. And for comparison, as I've mentioned before, a typical outdoor environment, may have more like between 100 and 1,000 versus the indoor air that is typically below 100. Okay, IAQ can save lives and energy. When properly sized and installed in HVAC systems, either ultraviolet light or bipolar ionization will have the proven third-party testing that demonstrates the ability to inactivate SARS-CoV-2. Added advantage of cleaning the air is the fan coils and reducing the need for as much replacement ventilation air. That's what generates the energy savings, and it often pays for the cost of the disinfection within the first year or two of operations. Remember, CDC guidelines, we start there, ventilating. So you're adding more replacement air. The problem is in the dead of summer and dead of winter, that is very costly because you're taking that outside air and you have to start from scratch. If it's 30 degrees outside in the winter and you want to get to 68 or 70, you have to work using energy to get that temperature up. Same is true in the summer, where if it's 90 degrees outside, you want to bring it down to 68, you have to pay to condition that air. If the air changes per hour in the ventilation cycle are drawing in every 15 minutes a cycle, and within each cycle of ACH, say 4, 20% of the outside air, that's typically a norm with the ASHRAE standards, the American Society of Heating and Refrigeration Engineers. If you double that to 40% ventilation, you are taking close to half of the air on every cycle and basically pushing it outside. You may have heard your parents say, stop air conditioning the neighborhood by leaving the doors open. Well, it's a great suggestion during COVID, during the peaks. But now that we're graduating out of COVID and can see some of the light at the end of the tunnel, we want to manage ventilation. And we can do that by holding the ASHRAE standards, but using ionization and ultraviolet to reduce the need to have excessive ventilation. Benefits that transcend COVID-19. This is reason number 5 to allocate resources towards IAQ. Reduce particles, reduce pathogens, neutralizing the odors, saving energy, and saving time on maintenance, because the devices which will be inputted into the system, the HVAC system, enhance longevity of the air handling units. That's a great bonus. With the particles, I don't know if you've seen these statistics, but there's about $20 billion a year spent on sick building syndrome, the allergens and the respiratory disease. This is clean indoor air quality to reduce healthcare costs, could be employee performance in terms of retention and less sick days. The same with students, healthier, happier people. Thank you for your time and attention. We will be open to questions through emails and look forward to circling back and connecting with you guys through Purge Virus